Welcome, everyone, to the Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I am joined, as always, with my co-host, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
I would like to call myself an expert.
You are an expert.
Expert on beauty surgery.
Surgery.
So what are we talking about today, Amy?
Today, we are talking about what happens when experts need experts.
Yeah, what do you do when you're the person that needs surgery? What do you do when you're the person that you're the nutritionist and you need nutritional advice?
Right. And I think that is a universal thing that even people who are extremely accomplished in their field, there are going to be times when you need to seek out an expert. So sometimes doctors need doctors, sometimes nutritionists need nutritionists. And what do we do in those times? Who do we go to for advice?
So first we got to go back. We got to go back to Steve Shaw, Paul Ravella, even Courtney Samuels. These are episodes. We've interviewed them before on this podcast. So one of the tenets we talk about in here is about empowerment, education, and transformation. You have to have people to help you with that. And we've talked about that before in our transformation episode. You can go back and listen to the episodes with all those guys. And they all say you need a coach, you need help, right? So clearly, if I'm a doctor and I have a medical issue, it's really hard to treat myself.
It is. Doctors make the worst patients.
And we'll probably hit on that, especially with me. So doctors make the worst patients. So that's why it's really important for you with your health and fitness and for transformation that you find someone that obviously you can trust. Sorry, I just want to put that in there. Go ahead.
No, but that's what I was getting at is, when you and I are looking for someone to help us, what are some of the things how do we vet a person?
First, and we've talked about this before, I like to know what, Amy, are they if it's a physician?
Oh, if it's a physician, I'd want to make sure that they are absolutely board certified in their specialty.
And that they've done all the training.
Mm-hmm.
I don't know how many times we have to tell people that, and they're like, what? Board certification?
I want to know where they have hospital privileges, if I need to be admitted somewhere.
Who's their team,
yes.
Right?
So you're a real doctor.
Secondly, what we do, if it's a doctor, we would like to, if it's a general practitioner or internist, you maybe take recommendations, but if it's something specific, you would want to know that they have expertise with the problem you think you have. So if you have a problem with your thyroid and you go to an endocrinologist, it'd be really good to go to an endocrinologist that actually has expertise in the thyroid. Now, that may sound crazy because everyone thinks endocrinologists all do thyroid problems. Well, some of them do, but some of them don't specialize in it. Some people just do diabetes. So you really want to seek out a person that treats kind of the problems you have, especially with medical problems,
Yeah, I agree. And it's not necessarily even just doctors. Like when we're seeking out an expert in any field, in the past, we've interviewed Paul Ravella. He was actually our coach for a while, and it was probably, a good 6 months to a year of me kind of like vetting Paul before I even reached out to him, kind of following him. Do I, looking at other clients that he's worked with, seeing how he interacts with his clients, seeing the things he posts, like looking at his certifications. Those kinds of things are really important to me. And it would be the same way for me if I was seeking help with nutrition. Obviously, I'd want to make sure that the person was educated at a level beyond perhaps what I am, so I knew that they were an expert in that particular field. My area of expertise with nutrition is more based on ancestral nutrition. But let's say if I had a patient who needed a specific autoimmune protocol. There are nutritionists who specialize just in autoimmune protocol or AIP, working specifically with ketogenic patients. Those are things that might be more specialized even within nutrition. So there are always, if you're needing something that's very specific, it's good to find someone who definitely specializes in that.
Right. And I talked to the fellows about this. You're only as good as your referral, like meaning that you need to be honest with whatever you do for coaching or for medicine or for nutrition or whatever. It's imperative that you surround yourself with really successful people that you could refer to.
Mm-hmm. So, absolutely. And you always want to have the best outcomes possible. So if you are an ethical provider of any type and someone comes to you with a problem or an issue that is not in your, is maybe not totally in your specific scope of practice. It is broadly, but not totally, you're going to refer them out. It's just like if someone had a podiatry issue and they came to us, like, yeah, you're a doctor and you do general surgery and other things.
I could do podiatry. I think I could do it.
Right. You think you could, but at the same time, like, you want the best outcome possible for his patients. So we're going to send them to a podiatrist,
right.
or to whoever is going to be the best fit for them. And
right. I think so. This seems like it makes logical sense. Like, why are Dr. Martin and Amy talking about this? I think a lot of times people get down a path and they're like, well, I'm just going to go to this person.
Mm-hmm.
What we're really saying is, no, go to the person that's best for you. Do the research. Find out they're board certified. Find out that they have expertise in the nutritional problem that you have. Find out that coach, that fitness coach, works well with people in your age group, et cetera, et cetera.
Right. General population, there's always going to be a level of specificity in what you're looking for. And to me, I think you go to that highest degree. That's what we look for when we're looking for experts in their field.
Wait, real quick on this. So are we going to tell my personal situation with this or not? Are we skipping
We're
over
coming to that.
Okay.
Because here's the bigger issue.
Oh, no.
What happens when a surgeon needs surgery?
Are we going to take down the veil that Dr. Martin never gets injured and he's not human? He's
self-rejuvenating, right? Captain America over there, you gotta heal yourself.
Yeah, exactly.
Doctor, heal thyself, right? What happens when you can't?
It's all stem cells. I just inject a lot of stem cells every day.
Right.
So recently, I had a sports hernia, an inguinal hernia. Inguinal means down by the groin. And
probably the most common place to get a hernia.
Yeah, it's common in kids. I used to repair them all the time in my training for children. And you see it in adults, specifically more physically fit adults because they get it playing sports. So
or lifting something heavy.
I have embraced strength training lately. I've loved it, and just developed slowly over time. I knew exactly what was going on. I could tell right away, and I knew that I would have to get this fixed. So
I'm a little disappointed that you got it fixed before Halloween. You didn't want to freak out kids with it.
Right. Showing people my groin.
Right, like look at my hernia.
Okay, that's disturbing. I would end up on news, Amy, if I'm showing all the kids my groin.
No, I don't mean anything graphic.
Oh, okay.
I just mean like let them poke at your
I'm going to
hernia.
pull down my pants here real quick, kid. I'm going to show you something really disgusting. I know that you don't know me and just came to my house for candy, but...
Watch this.
Yeah.
These are my intestines.
see at the peristalsis?
Right. Right. Watch them move.
Anyways, so I needed hernia repair. So fortunately for Dr. Martin, he knows pretty much everyone in Denver, and I went to the best guy, Dr. John Weaver. If anyone who lives in Denver has an inguinal hernia, go to Dr. Weaver. I do surgeries with him normally. We do combo surgeries. He does a lot of hernia repairs, and I'll do the tummy tucks. He does something called total extraperitoneal repair, TEP repair of the hernia. They use small laparoscopes or small TV cameras. They make small little incisions, nothing near your groin, more near your belly button, and they go down and repair everything without going around your bowels and without going on the outside. So it's awesome.
Pretty cool.
So cool. Took about 30 to 45 minutes. He did a great job. I never told Amy this, but the surgical assistant there that day was the surgical assistant that helps me a lot, Peter. So
you and Peter.
Yeah. So I'm sitting there preoperatively, and my surgical assistant walks in. I'm like, Peter, what are you doing here? He goes, I'm here for your case. I go, you better sew it up right. I taught you how to sew. You better sew this right.
Mm-hmm.
So,
don't mess this up.
Don't mess this up, Peter. And everything went really well. So I was very fortunate that I knew the best surgeon for that type of hernia repair, the best surgeon in Denver in this region. Highly recommend him. But sometimes you're not fortunate enough to have that. So you need to really do your research specifically to the problem that you have.
Yeah, so what I was kind of more interested in is what your experience was like as a patient. What's it like to be on the other side of the knife?
It is completely odd.
Right? I mean, you're used to walking into pre-op and
yeah.
just breezing through, walking into the bed.
First and foremost, the surgery was fine. It was rather painful, but that's expected. The after part of getting over the general anesthesia. General anesthesia is fat soluble, so it gets absorbed in your fat and slowly gets released over 24 to 48 hours after surgery. And the next day, I didn't take many pain medications. I was in the upside down world. I was not myself. I'm a high functioning person. I was writing emails and the words weren't coming out right. It was weird. It took me about 48 hours to get back on my feet.
Which is why we highly encourage our patients not to schedule conference calls, send work emails, do online shopping.
Exactly.
Like, this is not the time right after surgery.
No, absolutely not.
Yes. But so, you check yourself in, you do all your paperwork, they put you in a bay.
Oh, yeah, I forgot my paperwork. So all my patients that get angry with me when I chastise them for forgetting the paperwork, I forgot it all.
Good. So
Yeah.
you were starting off on the right foot. They get you all checked
Didn't have
in.
my insurance card. Left that at
Oh,
home.
perfect. Even better.
Yeah.
Yeah, you only had a book with you.
By the way, doctors are the worst patients ever.
As we mentioned that at the beginning.
And the best part was I get into the preoperative area, and I had the best nurse. I wish I could remember. Kathy W. at Rose Hospital. Kathy, if you ever listen to this, you were awesome. And if your name's not Kathy, you know who you are. You're the nurse that took care of me. Anyway, she went through the whole preoperative thing, and she was excellent. And Rose Hospital Surgery Center was excellent. Went through the whole preoperative thing and talking about everything. And finally, at the end of it, I kind of let on that I was a plastic surgeon. She goes, "Why did you let me talk for 20 minutes?" I was like, "Because you were doing such a great job. You were awesome." So
Right.
thank you, Kathy W.
Didn't want to like harsh your vibe.
Yeah.
Was there anything from like the start of surgery, like the pre-op, waking up from surgery, anything that kind of surprised you or that was different than you thought it might be?
Yeah, I mean, with general anesthesia, when you go through surgery or any kind of sedation, it can definitely, you definitely get disoriented. So you lose track of time, you wake up, and you're just in a new place, and hopefully you don't have a lot of pain. I could see why someone waking up with a lot of pain and being disoriented now, going through this would be really scary. But I didn't wake up with a lot of pain because they put a long-acting local Exparil in there, which is
That
great.
was awesome of them to do.
Yeah. So, you just it's very disorienting. By the time you get your wits about you, you kind of know what happened, and the time went by, and then it seems like only 20 minutes, but it's about an hour until you get out of there.
Yeah, I think that's probably one of the most common things that people ask when they're first coming out of anesthesia. When we're kind of there talking to them, the nurses are, arranging them. They've gotten rolled into the post-operative recovery bay. They'll look up at me and say, "Is it done? Is it over?" Or for our patients more specifically, like, "Do I have big boobs?"
Yeah.
Is
Is my stomach flat?
Right? Like, did he get it all? Meaning the fat.
You better liposuction.
Right.
Everything is all my fat gone.
Right? Did he do a good job? Because is it over? Is one of the very first things they'll ask, because, like you said, you lose track of that time.
Right. And a lot of time you wake up with the local anesthesia still in there, and you don't think it happened.
Right, because you're not feeling anything.
Yeah, you're not feeling anything.
You're just awake.
Yeah.
And you also don't really remember falling asleep, because a lot of times we give people medication that makes them forget that part of things.
Sure.
So, yeah. So, I mean, I think it's good, to be on the other side of things from time to time to make us remember what it's
I don't
like
want
to
to be
be
on
a
that
patient.
side very often.
No.
I like doing the surgery. I don't like being the patient, just so you know.
Well, it was like, a couple months ago when I had to have my wisdom teeth taken out, and I'm like sitting there in my scrubs like, I got to get to work. Like, can we do this now?
I know.
Like, let's get this done.
I was joking with Dr. Weaver before surgery that I had full clinic on Thursday and the surgery was on Tuesday, and he goes, "No, you don't."
Yeah, see, me and Weaver,
Are you sure?
We're tight.
And he's like, "Nope,
Yeah.
sorry." So, even surgeons need good surgeons. We all are human beings. You got to find the person that does exactly what you need and does it well. And I know this seems like, okay, great, this whole episode's about finding someone who does what you need and do it well. This is the key to almost anything when it relates to a transformation, medical treatment, nutrition, whatever. You need to find someone to guide you effectively and professionally. And so I found the right person. This is, I'm doing very well now. The repair was perfect. Everything's healing well. I'll be back lifting weights, doing the deadlifting pretty soon. And
How long do you have to be off weights?
4 weeks.
4 weeks.
Yeah.
That's not that bad.
Yeah, so that's really cool. With these TEPs, these TEP procedures, I feel like now I could do a whole podcast on extraperitoneal repair of an inguinal hernia.
Well, I'm interested in learning about it.
Yeah, so they basically unfurl. They make these small holes and they go underneath your muscles, but not inside your abdominal cavity. So that's the extraperitoneal space. And they blow up a balloon and then fill it with gas. So this is in the soft tissue, and then push this.
That's why you're so sore.
Sore, yeah. It feels like a gunshot wound.
Yeah.
And then they push a cannula down in there, and they unfurl this patch that just lays over the hole. And the patch itself has this kind of texturing to it, almost like Velcro. It sticks to your soft tissue. Over time, 6 to 12 months, the covering of that patch dissolves, and only like 40% of it is left. I'm butchering this. If Dr. Weaver ever listens to this, he'd be like,
that's not it at all.
Yeah, whatever you described with the TEP procedure I do was like completely wrong. So my description is correct because it happened to me. I'm the patient.
That's right. What Dr. Weaver hasn't had a hernia repair.
Whatever.
Yeah, what does he know?
Hey, you big little incision, then Peter came in and sewed it up. So that was really cool, and it takes them about 45 minutes. A lot of times they'll do the other side, but it's great. It's great to go to an expert. Dr. Weaver has done 3,000 of these. Not everyone does the extraperitoneal repair. You may go to a certain, Nils had it done. Did you have the incision in your groin, or did you have the in the groin, right? Yeah. Nils had the old school way. Nothing wrong with that. It works really well. I wanted the new way. I found the right guy or lady. Doesn't matter. Sex doesn't matter. It's whoever's the expert.
That's right. Whoever the expert is.
Yeah, and we got it done. So surgeons need surgeons is really a simple way to say that you always need to find the expert.
Yeah. So when I sent Sarah the slides, so if you're watching this on our YouTube channel, we're at Jason Martin MD, but this slide says self-care is self-love, and it's a picture of a dog in like a hammock with sunglasses on. And I put in parentheses when I sent Sarah the slide needs. In parentheses, it was Amy rants about body positivity and self-love. But this is really, I mean, more to the point of why we talk about finding an expert, making sure that you're seeking out an expert in their field, is because you're taking care of yourself. So there are times, I mean, many of the experts that we seek out are not emergency situations. We don't need surgery. We're doing things to make our life better, to make our life longer. I recently met with Dr. Brandt here in Denver, who is a anti-aging and hormone specialist, because I know him. He's an expert in his field. He's been doing it for a very long time in a field that doesn't have a lot of data behind it. He's been doing it for a very long time. And I want to make my life as good as it can be. I want to live a long, healthy life. So that, to me, like, finding an expert in their field is very oftentimes enhancing your life. In your case recently, it was for surgery, but anytime you're looking for someone to help you, like, you want to find someone because, like, you're taking care of yourself. Like,
right.
This is what we've
you're
got.
investing in yourself.
Yeah.
And that's especially true for, like, what you're talking about, for things that people often think they can just do themselves, like
right.
dieting.
Right.
Fitness. I can't tell you how important it is if you're boxing to get a boxing coach, if you're weightlifting to get a weightlifting coach.
Yeah, get a strength and conditioning
Amy
coach.
told me that, and I transformed my body. I mean, before that, I was kind of spinning my wheels. Intelligent guy, athletic. After that, I got a coach, done. 20 pounds off, muscle mass, body improved, great. And that was all from that. So, I think that it's really important that you spend a little extra money, and that's the other problem with all this. Some of these things cost money. Now, obviously, with medicine, you have the luxury of insurance. If you are fortunate to have insurance, that many times you can pick people that are good within your network. But a lot of these things like nutrition, fitness, yoga, whatever you think is going to make your value add to your life, costs money.
Right.
And that's worthwhile. And like you were saying with Dr. Brandt, I mean,
it's an investment in your health and your life.
That was expensive. Yeah.
Yes.
Yeah.
Very expensive. And, I think there are often times when you, especially with, I'm not trying to say I'm an intelligent person, but when you, perhaps are an expert in something, you think like, wow, well, I know a lot about this. Like, I know a lot about helping people like balance their hormones,
I mean, we get that all the time. Like someone comes in and they're an expert in, let's say, law. So they just feel like, because they're an expert at something, that they can figure everything else out. Doctors do that all the time. Right. That's why doctors are the worst people at investing. Because they think, because I'm super intelligent, I can figure out the stock market.
Right. I went to medical school. I can trade my own stocks.
Okay.
Right. Or I can, know what to do with a commercial building sale. Like, I mean, big things that like you do get that, like you think like, wow, I can just read a lot about this and I can learn a lot about this. But I think strength and conditioning is a great example. Like you can read every men's fitness magazine on earth and you're going to not be able to really maximize your benefit or your time. So,
because that extra 10% that a coach gives you, 20%, makes all the difference in your outcomes.
Right. And so that's
because the first 80%, like newbie gains with lifting, are the easy part.
Right. That's just the time.
Right. It's that 20% that you have to eke out, and that's just so hard. And that's true with anything, with any kind of training. It's true with surgical training. I mean, think about just my training alone. I had to go to the experts. I went to the best places, and I learned from the experts. I had guidance. I couldn't have done that on my own.
Right.
And I wouldn't have been as good of a surgeon if I didn't go to the best places. So I think it's transformation in your life comes from you making a decision, because change will always happen in your life, but the transformation comes from the decision from you taking the time, number one, saying that you're worth it, and then investing the money and the time to change.
Yeah. So,
to transform.
In these situations, like in anything in life, you have choices, so if you are faced with a choice that you need to make about your health, anything that's going on in your life, I mean, whether you need even something simple like getting your car fixed, does anyone ever really save money by trying to do a janky fix on their vehicle.
There's some people that really know how to fix their cars, but like these days, cars are all, like all electronic. You can't do it
Right.
anymore.
Or does the quick fix on their own plumbing system.
I mean, I would do that too. I'm not
Right.
even lying.
But eventually.
But it never works out.
Exactly. Like there are times when, you seek out an expert. And I think when it's your own health, when it's yourself, and that's what we're really talking about here.
Yeah.
And that's what we talk about in our
Health,
podcast.
wellness, yep. And nutrition, yep.
Take the time. Like, don't think of taking care of yourself as secondary, especially for, people who are busy. We work a lot. Like, it seems like an indulgence, right? It felt like a huge indulgence to me to do the appointment with Dr. Brandt. Like, it seemed so,
And what did I tell you? We got to do it.
Right. And it is important. And it's not, it is a privilege that we know experts in the field, but to not utilize them, like, that's kind of a waste.
Right.
Right. If we have all this at our fingertips and we have the accessibility of it and we don't utilize it, we're kind of selling ourselves short a little bit. And we're also kind of, not walking the talk, because we talk about how important these things are. And it is important. If it's important to us, if longevity is important, if we care about our health, if we care about our future, you kind of got to put the work in.
Yep.
Like, and those things are not selfish. They really aren't.
Keep on preaching.
Right. I know. That's why I wrote that it was going to be a rant about body love.
Yeah.
But
But I totally agree with everything you're saying.
Yeah.
So I don't think you're being outlandish. I mean, and we've talked about this before. People come in distraught in their lives. They feel like they don't have a lot of choices. They don't have hope and things like that related to their appearance. And many of the times it's just kind of changing your mind around,
Mm-hmm.
and then really taking the time to find the right people for you.
yes.
Not just going to. I mean, a good example in cosmetic surgery is people always just go to the next best thing, whatever they saw on the internet, or the cheapest, or whatever they saw on Groupon or whatever. And those things are fine. And, definitely I'm someone who likes deals and coupons and stuff like that, but it doesn't always mean that the outcomes are right. Maybe you do coupons and things that are inconsequential, and maybe find the expert or the person that can really help you. Spend a little bit of money there and time and do it the right way.
Yeah.
And that's especially true for nutrition. People, I don't know what it is about nutrition, even in doctors. They think, I can just figure this out.
Well, doctors are the worst.
Oh, they're the worst.
Trust me, when doctors
Who was it?
talk to me about nutrition, it's pretty hysterical.
What's his name? Lane Norton always
Norton.
talks about that. I mean, to the point that I get kind of annoyed because he's just bagging on doctors the whole time. But doctors are terrible with the nutrition. We don't really learn it in medical school. And Amy is the one who really taught me a lot about nutrition. I still have a lot more to learn. And you really need someone like Amy to come in and just really evaluate you with the NAC that she uses, which is the pre-nutrition test that you take, and to find out where your problems are. I mean, that's true expertise that you would never be able to do on your own. The second problem with doing things yourself is that you never judge correctly.
Yeah.
Your self-perception is always wrong.
You're not objective.
No, because
ever.
You may increase muscle mass for amazing, better than anyone. You're still going to think you suck. Or you may think that you look great and you really don't look much better than you did last time just because you're feeling better that day. So, the same is true for nutrition and for health.
It is. It's so true. And that's actually kind of off on a tangent here, but it brings up a great point. There was a person I follow on Instagram recently who was talking about body image, and she is actually she's a coach. So she is a health and wellness coach, and she was talking about how up in people's heads, or up in our heads, we get about the weight on the scale. So what she started doing for herself and had some of her clients start doing was, before you weigh yourself, kind of in your own mind, assess how you're feeling, right? Like, do I feel bloated this morning? Oh, my weight's going to be up. I feel bloated. Make those assumptions first and then get on the scale, versus getting on the scale, seeing a number and being like, oh, well, I feel great today. Or oh my gosh, I must be bloated. But are you really checking in with your own self first? And that's true with many things.
I like to call that check yourself.
Check yourself before you wreck yourself. But there's something to be said for that, with everything. And I even counsel my nutrition patients about that. When I do supplement with them, really, to me, and I might sound hokey, but it is meaningful. Really think about how you feel before and after you take these supplements, and tell me how you feel. Yeah,
I struggle with that kind of stuff, Amy, but you've made me better. I'm not the guy who can connect with myself before I weigh myself. I just want the number. But you're right, because what are we really saying is that we are not the most rational of beings, right? We as humans, we have a difficulty processing things. We see it in our clinic all the time. People come in that are beautiful and they feel so terrible. Mm-hmm. They look amazing.
Yeah, they look better than 90% of the population, and they are fixated on something that no one else would see.
Yeah, so that's why finding a coach, finding an expert is really important. Obviously, for the surgery example with me is self-evident.
You weren't gonna do your own surgery? You could do it.
I could do it.
You could do your own surgery.
I'm telling you. I could do it the Nils way, the old way.
Yeah.
It'd be hard to stick tubes down in there and
Oh,
blow
no,
it up with
It wouldn't
gas.
be hard because you'd have the screen. Like you'd have your arms.
I could do it.
free.
I could do it.
Yeah, you'd have the
I know how to do
robot.
it. I know how to do it.
Yeah.
I know it.
I know how to do it. You see.
I
what
mean,
is
it's on
it?
my groin. I could use both hands and do it.
Exactly. I mean, the C1.
I should have done it.
C1, do one, teach one. So it's
I don't
with
need
you.
a
It's
Weaver.
like C1, have one, do one, to oneself. When you tell me you're going to do your own facelift, I'm out.
Okay. I'm not doing my own face. All right. So, I mean, I think we've brought some truth today, don't you think?
I do.
Yeah.
Yeah. And, I think that we are fortunate in having a network of a lot of experts in our field, and also those experts know other experts. So if we're ever looking for someone, it's pretty easy for us to seek out someone. But if you don't have that, maybe you do. Kind of think of these resources that you do have in your life.
Ask friends and family.
Yeah.
Talk to people at work. If it's not something that is too personal, ask around, look, see, go on the internet. Internet's helpful. Look at reviews.
Yeah.
Do what you can. Take the time, do the research. It's really important. We tell
Yes.
people that all the time. People come see us for consults. We tell them, go get a couple more consults.
Yeah, it's important.
Yeah, make sure that you're
These are
okay
big
with who we are.
decisions.
Everyone comes in, they're like, oh, you're my guy. I'm going to you. And I'm like, hey, just relax for a second. Just make sure you're thinking this through completely.
Yeah. No, that's true with anyone you're looking for. Like the vibe you get from that person is important, but definitely don't just let that be the thing that sells you on somebody. Definitely really do your research. Remember, you're looking for someone to help you with your health and your life, and that's the most important thing you can do.
Yep.
Self-love.
Love yourself.
I think
Love
I
yourself.
kept that rant real subtle.
No, you were good. You were good. You didn't overdo it. It was pretty good.
Good.
We can get some clips out of that, put that on Instagram. Like, here she goes again.
Amy's angry ranting. I'm like the Hulk. I'm like the health and wellness
Yeah.
Hulk.
Before you chop this apple, think about where this apple has been.
Right.
Be the apple.
Right? Get in touch with yourself. Do you really want an apple right now? Would you rather have a pear? Maybe a grapefruit.
Are you feeling pearish?
How you feeling? All right. Well, thank you everyone so much for listening. We really do appreciate it. And if you enjoyed this podcast, be sure to like us, leave us a rating and review. It really does help other people find our podcast. And if you want to share us with your friends, that would also be greatly appreciated. You can follow us on Instagram at Beauty and the Surgeon Podcast, and also on YouTube at Jason Martin MD. We'd love to hear your thoughts, your feedback, your questions. Send us your questions. We can be your experts.
We'd love to be your experts.
Yeah.
And I definitely can do your inguinal hernia repair.
Yeah,
now
he's
that
had one. He's good.
I know how to do it.
Oh, yeah.
It's okay.
I'm going to do a
I got you.
facelift soon.
I got you.
Thanks, everyone.
See ya.